So circulatory system disorders. So certain conditions place people at greater risk of contracting a circulatory system disorder. So smoking, okay. Nicotine causes blood vessels to constrict, increasing the heart rate and causing a raise in blood pressure. Carbon monoxide competes with oxygen in the lungs, reducing the body's ability to carry oxygen. A poor diet, so this may produce high cholesterol levels, building fat in the arteries and restricting blood flow. And then little exercise. This makes fatty deposits increase, causing nutrients that are not used. Circulatory system disorders include high blood pressure or hypertension, heart attacks, which is damage to heart muscle, the high blood pressure or hypertension, which is a silent killer and can lead to strokes, which are brain damage. Respiratory system disorders, so smoking, air pollution, and industrial byproducts like coal dust can lead to disorders of the respiratory system. Cilia, which are the small hair-like projections in your lungs, beat continuously to remove airborne particles. Poisons in cigarette smoke and pollutants irritate the lining of the lungs, causing certain cells to produce more mucus. If the lining of the lungs become inflamed, it can lead to bronchitis, which makes breathing more difficult, which can further damage the lung tissue, causing emphysema, which is a shortness of breath, which is a permanent condition. Lung cancer is caused by the tar and smoke in cigarettes, which cause the lung cells to grow out of control, and tumors are formed, and they overcome healthy cells. So there's some information about what's in a cigarette. This is something that you guys would have learned with your BLAST program, which is really good that it happened at this time. When you look at other system disorders, so for your excretory system disorders, you can get gout, renal failure, nephritis, urinary tract infections, and kidney stones. For your skeletal system disorders, you can get bone diseases and bone cancer. For muscular system disorders, you can get muscular dystrophy, or MS, or muscular sclerosis. And then you can also get skin cancer. There's many system disorders, okay? So, looking at the past, the first vaccine was found in the late 1700s by Edward Jenner. He was an English county doctor, and he developed the first vaccine. He noticed that milkmaids who had cowpox, which is a mild form of smallpox, did not get smallpox, and he began infecting people with cowpox so that they would become immune to smallpox, and it worked. It was the first vaccine ever created, and the last case of smallpox was reported in 1979. Pasteurization, so Louis Pasteur was the first person to identify living microorganisms. He called them germs, and he suggested and later persevered his theory that these germs were the cause of most infectious diseases, and the process of heating food to kill the microorganisms worked. So this process is called pasteurization, and is still used today, mostly with milk. Okay, cleanliness. So once doctors knew that germs caused disease, other discoveries followed. So Joseph Lister determined that these germs were entering patients' wounds, so he introduced the practice of cleanliness and sterilization to surgery. When you look at nutritional research, so we should all know about Canada's Food Guide. So during the time of discovery, explorers would travel on ships very long periods of time, and the only foods that they would take were ones that wouldn't spoil. So many sailors developed scurvy as a result, with open sores, bleeding gums, loose teeth, and an unsteady gait. James Lind treated these sailors by feeding them oranges and lemons. It was later discovered that scurvy was caused by a lack of vitamin C. So this idea that you have poor diet choices. Finally, we're going to look at nutrition in the very last video of this section.